Welcome again to the Medical Terminology Podcast. This episode is Chapter 14, Part 6, Pregnancy and Childbirth. We have two specialists related to pregnancy and childbirth. The first one is obstetrician, obstetrician. An obstetrician is a specialist in caring for women during pregnancy, childbirth, and immediately after. The second specialist is a neonatologist, neonatologist. A neonatologist is a specialist in diagnosing and treating disorders of newborns. And now I have quite a bit of terminology for you that's related just to the anatomy and physiology of pregnancy and childbirth. The first term is corpus luteum, corpus luteum, corpus luteum. Corpus luteum is a ruptured follicle that begins secreting progesterone to maintain the growth of the uterine lining in preparation for a fertilized egg. The next term is the term for a fertilized egg, and that is zygote, zygote. Now, after the zygote implants itself in the wall of the uterus, it is called an embryo, embryo. An embryo is a fertilized egg that is implanted in the uterus up through the 8th week of pregnancy. At that point, the embryo becomes a fetus, fetus. A fetus is the term used for a developing child from the 9th week of pregnancy to birth. The next term is placenta, placenta. The placenta is a temporary organ that allows the exchange of nutrients, oxygen, and waste products between the mother and the fetus without allowing the blood to mix. Then we have chorion, chorion. The chorion is a thin outer membrane that surrounds the embryo. A related term is amnion, amnion. The amnion is the inner membrane surrounding the embryo. And then we have quickening, quickening. Quickening is the first movement of a fetus that can be felt by the mother. Okay, and let's do a bit of review over the terms I've covered so far. What is the term for a fertilized egg? That's a zygote, zygote. What is the term for a fertilized egg that is implanted in the uterus up through the 8th week of pregnancy? That's the embryo, embryo. And what is the term for a developing child from the 9th week of pregnancy to birth? That's a fetus, fetus. What is the term for a specialist in caring for women during pregnancy, childbirth, and immediately after? That's the obstetrician, obstetrician. And what is the term for a specialist in diagnosing and treating disorders of newborns? That's the neonatologist, neonatologist. And what is the term for a temporary organ that allows the exchange of nutrients, oxygen, and waste products between the mother and fetus without allowing the blood to mix? That's the placenta. Placenta. And what is the term for the first movements of a fetus that can be felt by the mother? That's a quickening. Quickening. And what is the term for the thin outer membrane that surrounds the embryo? That's the chorion. Chorion. Okay, and then I have three more terms related to anatomy and physiology of the development of the fetus. And then I've got some terms related to the mother. First of all, we have a term for a greasy substance that protects the fetus in utero, and that is vernix. Vernix. The next term is meconium. Meconium. Meconium is a greenish material in the intestines of the fetus that forms the baby's first stool. And finally, we have Braxton Hicks contractions. Capital B, Raxton, capital Hicks, and then contractions. Contractions. Braxton Hicks contractions are painless uterine contractions that occur with increasing frequency during pregnancy, but that are not true labor pains. Okay, and then we've got a collection of terms that describe women based on how many pregnancies they've had and also how many children that they've given birth to. And these terms are kind of odd. They have kind of an affected pronunciation, let's say. The first term is nulligravida. Nulligravida. It looks like nulligravida, but it's nulligravida. And this refers to a woman who has never been pregnant. Notice the first part of the term nulli, null would be like nothing, and it's got that suffix gravida that refers to pregnancy. Nulligravida, a woman who's never been pregnant. The next term is primigravida. Primigravida. The first part of the term prime means first, basically. And again, we've got the suffix gravida. And this is a woman in her first pregnancy. Think of it as her primary pregnancy. Primigravida, a woman in her first pregnancy. Then we have the terms related to the number of children that a woman has had. If a woman is nullipara, Nullipara, the woman has never born a viable child. Nullipara. And again, it's got that suffix para, P-A-R-A, which relates to birth. And again, the first part of the term nulli, null means nothing. So nullipara is a woman who's never born a viable child. Then what would you guess a woman who's born only one viable child would be? Well, if it follows the pattern here, that's going to be primipara. Primipara. Again, it's got the suffix para in it, P-A-R-A, which again relates to birth. And then the first part of the word primi, P-R-I-M-I, it's like prime, primary, the first. So primipara is a woman who's born one viable child. And then we've got a term for a woman who's had more than one viable child. She's had more than one, and that is multiparous. multiparous. And again, multi at the first part of the term would refer to more than one. Parous, Parous, would relate to, again, birth, condition of birth. So multiparous is a woman who's born more than one viable child. Okay, let's go ahead and do some practice with these terms. A woman who has never been pregnant is referred to as what? Well, that's nulligravida. Nulligravida. A woman who has borne one viable child is referred to as what? That's primipara. Primipara. And what is the term for a fertilized egg? Zygote. Zygote. What is the term for a temporary organ that allows the exchange of nutrients, oxygen, and waste, but not blood, between the mother and the fetus? That's the placenta. Placenta. What is the term for a ruptured follicle that begins secreting progesterone to maintain a possible pregnancy? Corpus luteum. Corpusluteum. What is the term for the outer membrane that surrounds the embryo? That's the chorion. Chorion. And what is the term for an inner membrane that protects the embryo? That's the amnion. Amnion. What is the term for a woman who is in her first pregnancy? That's primigravida. Primigravida. What is the term for uterine contractions during pregnancy that are not true labor pains? Those are the Braxton Hicks contractions. Capital B, Raxton, capital Hicks, contractions. Contractions. What is the term for the specialist in caring for women during pregnancy and immediately after giving birth? That's an obstetrician. Obstetrician. The term given to a developing child from the ninth week up to birth is what? That's the fetus. Fetus. A greasy substance that protects the fetus in utero is what? That's vernix. Vernix. what is the term for a woman who's born more than one viable child? Well, we would say that she's multiparous. multiparous. And what is the term for a specialist in newborns? That's the neonatologist. neonatologist. And finally, what is the term for a woman who has never born a viable child? Well, that would be nullipara. nullipara. Okay, well, that covers anatomy and physiology. Now we're going to go ahead and look at some pathologies and procedures. The first one is preeclampsia. Preeclampsia. Preeclampsia is a pregnancy-induced hypertension. That is a condition of high blood pressure, which also includes edema and proteinuria. Then we have eclampsia, Eclampsia. And eclampsia is a more serious form of preeclampsia, and this can result in convulsions and sometimes coma. The next term is abruptio placentae, abruptio Abruptio placentae is when the placenta separates from the uterine wall prematurely. Then we have placenta previa, placenta previa, previa. Placenta previa is an abnormal implantation of the embryo in the lower part of the uterus. And then I have three procedures for you. The first one is chorionic villus sampling, chorionic villus, villus sampling. Chorionic villus sampling is the removal of cells from the chorion to test for genetic abnormalities in the fetus. And a related diagnostic test we've probably all heard of is amniocentesis, amniocentesis. This is a surgical puncture with a needle to obtain amniotic fluid, which is then tested to diagnose congenital disorders. And finally, we have Apgar score, capital A, PGAR score, SCORE. And this is an evaluation of a newborn's physical status based on 5 factors and a 10-point scale. Each factor receives a score of 0 to 2. And those factors are heart rate, respiration, muscle tone, response to stimulation, and color. Okay, and let's go ahead and do a little practice with these terms. What is the term for pregnancy-induced hypertension? That is preeclampsia. Preeclampsia. What is the term for the premature separation of the placenta from the uterine wall? That's abruptio placentae. Abruptio And what is the term for the genetic test in which cells are removed from the chorion to test for abnormalities? That's chorionic villus sampling. CHORIONIC villus, VILLUS, sampling. The removal of amniotic fluid using a needle is known as what? That's amniocentesis. AMNIOCENTESIS. What is the term for the abnormal implantation of the embryo in the lower portion of the uterus? That's placenta previa. PLACENTA PREVIA. What is the term for a more serious form of pregnancy-induced hypertension that can cause convulsions or coma? That's eclampsia. ECLAMPSIA. And finally, what is the term for the numerical evaluation of a baby's physical status at birth? That's the Apgar score. Capital A, PGAR, score, SCORE. Okay, well, that brings us to the end of chapter 14. Good luck in your studying and preparation for the test, and when you're done with this one, we've just got one more to go. This ends this episode of the Medical Terminology Podcast.